Assalamu alaikum wa rahmatullah. Hello everyone and welcome to your English class. Hope you're all doing well today. Let's start with our lesson today. In our lesson today, we will continue with the introduction lesson and it's going to be on page 5. All you need for the lesson today is your books, page 5, and a sheet of paper and a pen in case you need to take any notes. Ready? Let's get started. At the beginning in here, let's go over what we have taken yesterday for the lesson yesterday. We have discussed the topic of greeting, introduction, and farewell as functions, conversation functions. How to greet someone, how to introduce the other, and how to do a farewell. These are some expressions that we can work on. Hi. Is it a greeting, introduction, or a farewell? When you say hi, you are greeting someone. Have a good day at the end of the conversation, so it's a farewell. How about see you soon? See you soon is a farewell. How about meet my mom? I want to show you my mom. This is an introduction. Then, this is Sam. This is my friend Sam. Meet Sam. This is an introduction as well. Then, the last one, how are you? You can greet someone by saying, how are you? So, greeting at the beginning of the conversation, introduction to you want two people or two groups of people to meet each other. You know both of them, and farewell is to say goodbye. Okay, these they are. For our lesson today, you are going to be able to answer some questions on a conversation. We will listen to a conversation and you will be able to answer certain questions. Then you will recognize feelings from intonation. At the beginning, we will discuss what an intonation is. Then how can you tell from this intonation how the speaker feels? Then make an appointment. The idea of making an appointment. Let's get started. At the beginning in here, on page 5, I want you to look at the picture. What can you see? It's a picture of a dental's office, a dental's clinic. When was the last time you have been to a dentist? A doctor for the teeth. Had you had any problem, so you had to go to the dentist? If you feel anything wrong, any pain in your teeth, or just for regular checks, you can go to the dentist. Let's try to answer these questions. How do you feel about going to the dentist? I will tell you that tomorrow you're going to have an appointment with a dentist. How do you feel? Not a fact, opinion. Feeling, how you feel towards it. Do you feel that this is normal and I like going to the dentist? Or you will say, no, I'm anxious, I'm stressed, I don't feel comfortable going to the dentist. It depends on you. How about, what do you need to do to keep your teeth healthy? Your teeth, I want them healthy. What can you do? You have to follow a healthy diet. You have to avoid or listen to eat less of anything that is acid, like the lemons and these things, and sweets. How about the regular routine? Every day you have to brush your teeth and floss them. How about here? Do people have to make an appointment to see a dentist? I want to go to the dentist. Are you going just to walk in, or you have to make an appointment? It is better to make an appointment before going to the dentist, so you will make sure that you can meet him or meet the dentist. Then, how do most people make appointments? I want to make an appointment. How can I make it? We're having many options. You can call, you can go by yourself and you can make the appointment there. And you can, if they're having an application or a website, you can log in and make your own appointment. Usually people make phone calls to make appointments. Okay, let's continue. Now in your book's page 5, we're having a conversation. Who are the speakers in here? Check the whole thing and tell me who's speaking in this conversation. A teacher and a student? A mom and her daughter? No. It is between the two who are the receptionist, the one who's working at the reception, and Mrs. Phillips. And from the picture you can tell that it is about a doctor's clinic, a dentist's clinic. Not any doctor, she is actually a dentist. Okay? Now I want you to listen to the conversation and tell me what are they talking about? Are they talking about she will give her a medicine? What is she trying to do? Let's listen.
Dental Health Center, good morning.
Good morning. This is Meg Phillips. I'd like to make an appointment, please.
Of course, Mrs. Phillips. Let me see. The doctor is available on Monday and Wednesday afternoon from 5 to 6 next week.
I see. It's rather urgent, I'm afraid. Could I see her sooner? I'm in a lot of pain.
I'm sorry to hear that, Mrs. Phillips. I'll see what I can do. I'm afraid she's booked up today and tomorrow. Let me have a word with her, and I'll get back to you.
Thank you. I'll wait.
Hello, Mrs. Phillips. Can you make it this morning, in about an hour? There's been a cancellation.
Yes, of course. Thank you so much.
You're welcome. We'll be expecting you in an hour.
So the conversation between the receptionist and Mrs. Phillips, what is the main idea? What are they talking about? Mrs. Phillips is trying to make an appointment. She wants to see the dentist, so she's calling the reception or the receptionist who will make her an appointment. Okay? Now let's listen one more time. And I want you to identify the speaker's attitude or feeling. From how people say the word or the sentence, you can tell me, is she happy? Is she anxious, stressed? Or she's calm and maybe she's sad? Just listen and tell how she feels. Maybe you will tell me, if your mom is speaking, then you tell, why are you mad at me? So, from how someone is speaking, you can tell how they feel. Let's listen to the receptionist at the beginning, and I want you to tell me, how does she feel? What is her attitude? Let's listen.
Dental Health Center, good morning. You're welcome. We'll be expecting you in an hour.
That she feels. How does she feel? Is she mad? Is she happy? She is pleasant and professional. A dental health clinic, good morning. She's not excited and she's not mad. Something that is flat, good morning. Okay? How about Mrs. Phillips? Let's listen to her. Is she mad? Is she happy? Or she's calm? She's having different feelings actually. Let's listen to Mrs. Phillips.
Good morning. This is Meg Phillips. I'd like to make an appointment, please. I see. It's rather urgent, I'm afraid. Could I see her sooner? I'm in a lot of pain. Yes, of course. Thank you so much.
So, how does she feel, Mrs. Phillips? At the beginning, when she was greeting the receptionist, she was composed and calm. She had no feeling. She's calm. She's okay. Then the receptionist told her that you can't make an appointment with the dentist. She's fully booked. Then she became anxious. I'm in a lot of pain. She's anxious, she's stressed, she's in pain. Then the receptionist told her, it's okay, you can come in an hour to the clinic and she can check up on you. And she was thankful or grateful and relieved. Thank you so much. I will see you in an hour. So at the beginning she was calm, then stressed, then she became calm one more time again. Okay? This is how to tell about people's feelings. So when we are speaking about how these people feel, we are not checking what they say. We are actually checking how they are saying. We are checking the rise and the fall of their voice while they are speaking. Hi or hi. How they feel based on how they say the word. This is what we call it an intonation. Intonation is the rise and the fall of the voice while people are speaking. So if your teacher is coming into the class and she will say hello, she's okay. When she say hello, she's happy. When she say hello, she's not happy at all. You can tell from how people speak, the way they're speaking, their attitude or their feeling. That's why sometimes we will say, I feel that she's not happy, she's mad, she's shy. Okay? So it is the rise and the fall of the voice in speaking. And intonation, the use of intonation is international. Think about or go and listen to someone who's speaking French or someone who's speaking someone who's speaking Chinese. I don't speak these languages, but I can tell you how they feel. So intonation is how to say rather not what to say. So I'm focusing on the feeling, not the meaning. We all agree on the meaning. Hello and hello having the same meaning. However, the feeling, how the speaker feels is different. Here, let's check it's raining. How can you say it's raining in a rising intonation and a falling intonation? I will tell you, it's raining. How do I feel? Composed, no feeling. When I tell you, it's raining, I'm not happy at all. However, if I'm very happy about the rain, I will say, it's raining. It's raining. You see? The rising intonation. Raining. Rising. Happiness, high feelings, or let's say accelerated feelings, and low feelings. Okay? Rising and falling. Try to practice. It's raining and it's raining. This is the difference. The feeling, not the meaning. Now, we will listen to the receptionist one more time, and we are going to mark the sentence with a rising or falling. Let's listen to the receptionist's words.
Dental Health Center, good morning. You're welcome. We'll be expecting you in an hour.
So, when she said Dental Health Center, good morning, she was having all of them are falling intonation. She didn't say Dental Health Center. No, Dental Health Center. Good morning, not good morning. Falling. Professional. Not mad, but professional. How about Mrs. Phillips in here? Mrs. Phillips, I'd like to make an appointment, please. How did she say it? Let's listen.
Good morning. This is Meg Phillips. I'd like to make an appointment, please. I see. It's rather urgent, I'm afraid. Could I see her sooner? I'm in a lot of pain. Yes, of course. Thank you so much.
So we can notice at the beginning she was calm, she was okay, she didn't have any feelings, just a greeting. I'd like to make an appointment, please. Not excited at all, not mad, flat. Then, could I see her sooner? You can't see, I will tell you, you can't see the dentist. She said, could I see her sooner? She wants me to feel, she wants the receptionist to feel that she needs to see the dentist very soon. I am in a lot of pain. I'm in a lot of pain. Rising intonation. Then she could see the dentist, so of course I will come. Thank you so much. Falling intonation. So here in these three situations, she was having rising intonation because she was excited, maybe she was happy, or she needs something so bad. However, for the others, no, falling intonation because we're having no feelings at all in here. Okay? Now let's listen again to the conversation because I want you to come up with answers for these three questions. When is the doctor available? What is Mrs. Phillips' problem? How did they find an appointment for her? Let's listen and you will come up with answers for these three questions.
Dental Health Center, good morning.
Good morning. This is Meg Phillips. I'd like to make an appointment, please.
Of course, Mrs. Phillips. Let me see. The doctor is available on Monday and Wednesday afternoon from 5 to 6 next week.
I see. It's rather urgent, I'm afraid. Could I see her sooner? I'm in a lot of pain.
I'm sorry to hear that, Mrs. Phillips. I'll see what I can do. I'm afraid she's booked up today and tomorrow. Let me have a word with her, and I'll get back to you.
Thank you. I'll wait.
Hello, Mrs. Phillips. Can you make it this morning, in about an hour? There's been a cancellation.
Yes, of course. Thank you so much.
You're welcome. We'll be expecting you in an hour.
So, when is the doctor available? Usually, the doctor is available Monday and Wednesday afternoon from 5 to 6. So, the doctor is available on the afternoon from 5 to 6. When? For time. That's why we will answer Monday, Wednesday, 5 to 6 afternoon. Second one, what is Mrs. Phillips' problem? She's having a problem. What is her problem? Her problem is that she's in pain and the doctor is booked up. She is in pain. Her teeth hurt. However, she can't see the doctor. Why? The doctor is fully booked. We're having many patients and she can't see you. This is the main problem. She's in pain, has a toothache, a pain in her teeth. She can't see the doctor. Then, lucky they found her an appointment. How did they find her an appointment? She was lucky and they found her an appointment because there has been a cancellation. What do we mean by a cancellation? Someone was about to come, however, they have cancelled. They're not going to come, and she can fill up this space or this appointment. It's always a good idea, and it is highly recommended that you cancel and call and cancel your appointment so anyone who would need this appointment will come and fill it up. Okay? So this is about the conversation. For your homework, I want you to practice different intonations for the word hello, for the expression hello. Say hello if you are having a rising intonation or a falling intonation to a friend, to a teacher, to someone that you know, someone that you don't know. Just one expression, which is the greeting hello, in different situations. Okay? Thank you so much for your time, and see you inshallah tomorrow.